without further ado, I would like to present Wanda Santiago, a passionate healthcare professional whose inspiring journey from Puerto Rico to Connecticut has inspired countless lives. So to support nutrition and expertise and lead a fun, interactive activity for you all to help decode nutritional facts and you can make healthier choices with confidence. Welcome, Wanda.
Thank you. Good evening. Thank you for having me. Thank you, Church of the City, Pastor Jesus, for the invitation. And of course, Hispanic Access Foundation. This is a great opportunity for me. I'm Wanda Santiago again from Puerto Rico. And I have to tell that I am not used to do this. I'm used to work with patients and feel comfortable in talking about diabetes and nutrition, but this is kind of different, but I hope it's a good experience. So I'm gonna talk a little bit about my journey, and I'll talk saying these words that I have in here that are very important. This has been full of challenges and growth. When I moved to a new city, I started from scratch. Which was not easy. I went from being a nurse to working directly with the community, focusing on promoting healthy eating and diabetes management. Through this work, I have learned a lot about the needs of different people. My goal is to make positive impact on the community and to learn something new every day from my patients. So how I started. When I was in high school, I had the opportunity to take additional certification. So I was also graduating from my general diploma, but as a medical office assistant. That was a great opportunity because we were able to visit different centers so we can practice with general doctors, with psychologists, psychiatrists. So it was a good start so you can learn what really you like or what really you will do in your future. When I graduated, to be honest, I was not sure what I want. So when my initial plan, because my older sister was a nurse, was start nursing. But when I went to that same college, the class was full already. And they told me, well, you can register another class, and if you change your mind, or if we have a space, we're gonna call you. So I did that, and I started doing office administration first, an associate degree. A month passed and they told me we have space, and I'm like, wait, but I like this already. I don't want to move right now, so maybe it was not the time, but I stayed and I completed my associate degree in office administration. I graduated, and then after that, I say, well, maybe it's time, I'm gonna start nursing now. I start nursing, an associate degree in nursing. I graduated from that associate degree, and I didn't jump right away to the bachelor degree because I said, let me see, I'm still looking what I want to learn. I was not planning to do the BA. I was like, I'm done. I think I don't want to study anymore. I want to keep working. I registered to do the bachelor degree in nursing. And I remember at that time, after a month, I got pregnant. I have a beautiful daughter, 11 years old, Catalina. She's in there, so proud. So I started with the support of my family because that was really, really important in that part, in that process. I graduated from my bachelor degree. I didn't stop. That was, I have to do it. I have to complete it. So I did that. Then I started working as a nurse. But when I started working as a nurse, it was a good experience also that I will never forget. You have to prepare for the interview, you have to prepare your resume, and I did apply to work with a urologist in a medical office. And I went to the first interview, I passed the interview. In the second interview, it was so challenging that day, maybe that was not for me. And when I finished that interview, I remember the second interview of that nursing position, I called my dad. And I said, you know what? That was not a good second interview. That job is not for me. I did so many mistakes in that practice. Maybe that job is for the next person. And my dad said, okay, no problem. This is, as you mentioned, this is practice. That's how you learn. The next day I got an email from the administrator of the office they select the other candidate. That is always painful. That always hurts, but you learn. That's how you prepare, right? I responded to that email because when I did my associate degree, I remember something that that professor told us at the beginning. If you go to an interview and if you fail, you respond that email and you say thank you for the opportunity. And I did that. I won't forget that. The administrator replied that email saying it's the first time someone respond my email when I don't choose a candidate. And he told me if I administrate other offices, so if I know any position, I'll call you. I say thank you. 2 weeks passed. He called me back. And he offered me a position in the same office where they hired the other nurse. And I started working in the front desk, office administration, where I did my associate degree. So I took that position. 3 months passed. You know what happened? The nurse resigned. Guess who was the nurse? That was a good experience because I learned everything from the front desk first, everything also from the back, and then I ended up being the nurse over there. It was a good experience. That was my first nursing experience. A beautiful photo when I graduated from the bachelor degree. But those steps, and when I start doing this with Gachira from the Hispanic Foundation, she's grateful. I'm grateful from her. So supportive during this process. When I have to put all these things down, I was like, wow, I did all of that. That was my experience. And when you talk about it, it sounds so different because it's the first time I am talking about my experience. And it's when you can, reflect and say, the journey, the ups and downs, what a journey. So after having experience as a nurse, of course, I was done with the bachelor degree in nursing. No idea to start over again. I received an email from the college. The same college that I graduated, they were offering the master degree. And I saw that email, and I remember I told a friend of mine for that time, they offering the master's degree in the same college. And she was like, you're too busy. You have a full time, you have your daughter already. I don't think you can do that. And I said, well, it's true. I have a full-time job. I have my daughter. I don't have time for this. I called my dad. Because I know my dad will always have a different words. Because I was a little bit excited about the master degree. So I called my dad, and my dad said, go for it. That's it. Simple words. What could go wrong? Just go for it. And I said, you know what? I will find more information, and I will think about it. I called my older sister. She was a nurse already. Hey, what do you think? You want to do that? And she was like, oh, I'm not sure about that. And I said, you know what? I'm going to do it. I'm going to start. And if you want to start, just let me know. I'm going to provide you the information. We started the master degree. I regretted so many times. I was working full time, 6 p.m., 7 p.m., going to college, picking up my daughter at 11 p.m. That was 3 days a week. It was a year and a half. So many times that I said, I can't do this anymore. This is too much for me. And a short story about that. I don't know how many here have older sisters, but that was such an amazing experience. And I can say that because we finished already. But during the process, I said, what did I do a master's degree with my older sister? This was her during every single class. When a professor asked, who going to present for this, Wanda and her name is Wailanis first. And I'm like, you didn't ask me. Wait, like I don't want to go first. In every single presentation, she will do whatever she wants to do, like older sister. And that was, you know what, I can do nothing. We were working it. The day of our first presentations, I did the biggest mistake ever. I was working that day. I was supposed to finish our presentation, and I have the half on a USB safe. I lost the USB, the pen drive, the same day of the presentation, of our first presentation. My sister was doing 7 to 3 p.m., I remember, and I was like this, shaking. The whole morning, I couldn't even eat that day because I was crying, going to the office, to my car. I went home twice looking for that USB where I have saved that presentation, and I couldn't find it. It was almost 3 p.m. I have to call my sister. I have to tell her. I'm not gonna say what she told me over the phone. You can imagine. So I start crying. I start crying like crazy, and she said, "You know what? I am leaving soon work. I'm going home. We will work on that presentation, but there was no excuse when you are doing a master degree with your professors in the college. There was no excuse to call the professor that day and say, hey, I lost a pen drive, because what they gonna tell you, right? So she went back to her home. She did what she could. We started the presentation. I almost cried during the whole presentation, but we did so great that day. And we were the first ones. So I remember the professor said, well, that was perfect. So you guys now have to be prepared after that presentation. And we were done. I couldn't, my eyes were swollen. I was crying and crying and crying. And then we tell the professor, I lost a pen drive. I lost a USB. And she was like, why you didn't tell me? And I'm like, I'm not sure if you believe that. I'm not sure. I went to the car. And when I went to the car, I opened the door, the USB was there. I will never forget that. I will never. I called my sister. She was like, I couldn't believe it. Maybe that was meant to be, because you know what? I never had so much support from my sister since that day, and that was a good experience. We both cried during the process. It was very challenging, but we ended up graduating together and walking together. So I did my master's degree with my smart, beautiful older sister, and I think that was one of my biggest accomplishments, to be honest. So what happened after that? I was working as a nurse still in Puerto Rico, but my mom came here to visit a cousin. That was random. My mom met someone from working with DCF and in another department. And she said, oh, we need someone who speaks Spanish for our department. And my mom called me and told me that, like, out of nowhere. I don't have any plans to move to the United States. I was living in Puerto Rico my whole time. I was working, but my mom told me that, and I was like, what? I don't know what to do. Let me just, I don't know, maybe go in and update my resume. Maybe apply for a few positions to see what happens. I was not taking it that seriously until I started getting calls. I started getting calls for different organizations here, and again, guess what I did? I called my dad. And I say, listen, I updated my resume. There's organizations contacting me, and he would again go for it. What could go wrong? You have here open doors. If it doesn't work, you will come back home. That's it. Let's go for it. I decided to take that risk. No plans. I didn't have any money to come here. I'm grateful for my cousin, Angelica. It will always be that she opens the door of her home. And I came here on a December. And I came here on December. That's coffee from Puerto Rico, okay? That was my first snow in December here, but that's coffee from Puerto Rico. I remember that. And when I came here, I said, I don't know what I do, but you know what? I'm here. We have to do whatever. That was a Sunday. Next Monday, I had my first interview. And the same week, Wednesday, I had my second interview. And let me tell you, I've learned a little bit of English during that time, but when I came here, barely speak English. In Puerto Rico, we usually speak Spanish, so I barely speak English when I came here, but that's how it started. I had experience. I decided to stay close to my cousin during that time, and the job that I started as a community support worker, also working with DCF, visiting the families in the community and helping them with the resources, because I needed experience. I said, I need an experience, I need to get better in my vocabulary, so I'm gonna start here, and then let's see what happens if I go to the hospital or another medical office. Let's see how it will be. I wasn't sure at the beginning. I even remember so many times that I wanted to go back. You know, new weather, new challenges. I didn't have car. I have to learn everything, the community, no friends, just that cousin. And there was a situation with my daughter during that time. I'll try my best to not cry. So, but during December, you know, when it gets darker earlier, that doesn't happen in Puerto Rico usually. She thought that she was in the wrong school bus, and when she got out, my daughter was 5 years for that time, and she said, "I was so nervous, Mom. I thought I got another bus. I was so nervous. I was shaking and everything. I felt so bad." And she told me, "This is your fault. I want to go back to Puerto Rico. This is your fault." Imagine how, as a mom, I felt. I said, maybe it's time to go back. I'm not sure. I have so many feelings. I cried for like a whole week. And I said, you know what? I came here for a reason. I'll keep going. I'll keep going. A year passed. And after a year, I had an opportunity at L&M. I'm so grateful from Lotto who gave me the opportunity. Working as a community health worker. And when I started working as a community health worker, COVID started. So after a year of experience and challenges, I moved to the hospital. She said, we have to work with patients with diabetes, and what I'm going to do. And she said, you will figure out. And I'm like, okay, I'll figure out. So my journey started. And I love this title, Empowering Health, a Journey in Healthcare System and Community Impact. That's how I started working more with the community. So during COVID, it was so hard to keep the patients engaged. Keeping the patients attending their medical appointments, following a healthy diet. There was patients that were so depressed during that time. And I told my supervisor a few times, I have no idea what I'm doing. And she said, just do what you want to do. And I say, okay. I call that the magic bag. I grab the goodies and information, and I start delivering that to the houses of my patients. Also, during COVID, between the hospital, Leshlie, which is the health district here in London, they work in collaboration because there was a lot of food insecurity. And I had patients that were facing food insecurities. You know what I did? With that bag, I also brought a box of food, healthy food, and I will deliver that to my patients. And I did that during COVID. Engaging the community, trying them to eat healthy, and following up medical appointments, making sure that they're understanding their medications, why it's important. I did that during COVID, and to be honest, I wasn't sure if I was doing the right thing. I felt lost many times. That was the only thing that I could come with, and I wasn't sure if I was doing the right thing. But then my supervisor that was like a referral. She didn't explain that honestly, that was a referral, and she nominated me for to be part of the hospital. Well, they have a campaign in New Haven Health. They call it for the greatest of with the greatest of care. And one day I went to the hospital. I saw myself in the hospital, and it said healthy communities. And I thought, I think I'm doing a good job. I think I'm doing the right thing. Even when I feel lost, or even when I'm not sure what I'm doing, seeing myself in that photo, and that was not my plan. I never expected to have that impact in the community, but I'm so grateful that I did that. And after that, again, still during COVID, I always say that I'm not going to study anymore, because even during COVID was so challenging. Everything was, you know, I couldn't even think. That was part of we asked, because we care campaign. Sorry, I was jumping to this one. There you go. During COVID also, I told my supervisor, I think I need to study something more, even if I didn't want to study anymore. I want to learn how to support more the community, but promoting whole food plant-based. So my supervisor was so supportive of that, and I did a certification about whole food plant-based because I wanted to teach the community how to eat healthier, how to eat better, but I wanted to incorporate more whole food plant-based, more vegetables, more fruits. That was my initial focus. And I did that during COVID too. I also during COVID did a medical certificate, community interpreter in medical too. That was also during COVID. So even every time I say I'm not gonna study anymore, I start studying something new. And I have to accept that I love learning. I love learning, I love having this knowledge, and I also love learning from my patients. So this is important, keeping learning, which is there. The other one. So what do I do as a community health worker? A lot. So as my department is Office of Health Equity and Community Impact, and we promote a lot what is health equity, which means that everyone has a fair and equitable opportunity to be as healthy as possible. So my job as a community health worker, besides working with patients that has diabetes and promoting healthy eating, but helping them to find the resources that they need, is also promoting this. So I'm gonna show you something now that is, this photo we also show it in our department, to see the difference between equality and equity. The same accommodations, good. So in equality, we are offering everyone the same bicycle. But in equity, we need to promote and we need to give the community of the patient what they need. It depends on their need. So in this case, we're offering them basically what they need to run that bicycle. But because if we give the same one, the child will struggle and the first person couldn't get to the bicycle. But if we give equity, they will just success because that's what they need. So equity means that everyone has a fair and equitable opportunity to be as healthy as possible. And that's what also we try to promote in the community. What I also do as a community health worker. So super important, not only helping the patients access to health, that's very important, but free community programs, and I'm gonna talk about resources that we have at the hospital too, self-management education, nutrition support, interpreting services, diabetes resources, community resources connections, application support, communication, financial guidance, community engagement, educational classes. By focusing on these areas, I aim to improve the health and well-being of our community members. So do you know, and this is something that I work a lot with patients because we work with patients from different countries. In the Community Health Center, which is here in New London, they offer a skill program at low cost, and visits will start at $20. That doesn't matter if you have insurance or no. And also important to know, because there's a lot of people that are not aware about this, Yale New Haven Health has a financial assistance program. We call it free care. So they just need to apply. They can apply online. They can go to the hospital. The free care program is, you can get it for free depending on their income or a discount. If you get the free care program and you qualify for that program, you will receive a letter. That means that that patient will get free assistance, free care from Yale New Haven Health. That includes hospital, doctors, medical providers, everything under Yale New Haven Health. Unfortunately, it doesn't cover prescriptions or medications, but it's important to know that they have the free care if you don't have insurance, but they also have a discount. So I have many patients in the community that don't go to ER because they don't have insurance, or don't go to their medical appointments, or don't follow the medical appointments because they don't have insurance. But if they apply for this program, they can have free care. That's very important. They don't cover medications, but there's a new pharmacy at the hospital. I don't know if you heard about that. That pharmacy has a program that is called Dispensary of Hope. And participants that qualify can get medications for free. no idea how many patients I have that don't follow their medical appointments because they cannot afford the insulin. And this program covered the insulin for them. They just need to go there at the pharmacies. It's their first floor in the entrance. They will apply for the program, and the staff will tell them right away what they have available. The doctor just needs to send the prescription over there, and that's it. I have so many patients that they cannot afford the insulin, but my job is to find the resources so they can have their medications. The next one. So as a community health worker, you have different options. I am certified from the state of Connecticut, but when I started at L&M, I was not certified. The good part was because I had so many hours already, when I did the application online, I passed those hours, and I just needed a letter from work that I had those hours, so I can just do my application online. Or you can have your certification as a community health worker if you have any experience in the community, or you are a volunteer and you can provide the documentation where you work more than 2,000 hours. So you can be certified as a community health worker too. That's a good certification to have, and also that's good for your resume or for more opportunities if you're looking for that. There's different community health worker certifications. I know the adult education here offer it, but so as information, the CT State Community College offer this program too, and there's different campuses near here. There's one in Norwich, Danielson, Hartford, New Haven, and Bridgeport. They can offer, you can go study right away. So if you want to go to college and study community health worker, you can do that. But also, if you have experience already working in the community or working as a community health worker, maybe it's an easier process to just apply with the state. As a community health worker, I also go to the community at different events. That could be at school, that could be events at the church, that could be any community events, promoting the programs of the hospital and healthy eating, of course, and also participating of the food pantries that we have here in New London area. And now that I mentioned food pantry, we have an amazing food pantry that is in collaboration with the HIC, which is other organizations, and the hospital, New Haven Health, and Ledgely Health District. There's an amazing food pantry that it calls Food for the People. It opens 3 days a week where you can have free fruits and vegetables and other food, and it's important that community know this because we face a lot of food insecurity. This is completely free for the community. You can just go there, register, and you choose what day to go during the week. I always promote this because right now how they put it is like a grocery store, and you can just go there and do your grocery and choose whatever you need, and that's so important. For the next one, what I also do is classes when I talk about diabetes, I talk about healthy eating, and not just that, focusing on what diabetes is, but I have so many patients from different cultures that say, I don't know how to start. I don't know what to make at home. I don't know what to eat healthy. So I started this idea on nowhere. You know what? Let's talk about not nutrition, because that word can scare a little bit. Maybe going on a diet. I don't use that word with my patients. I use it modifications in our lifestyle. And when I receive referrals from the doctors, my experience with a lot of patients is they will tell the doctor, yes, I'm eating healthy, I'm taking my meds. When I call them, and I do this approach, frankly, just to understand what's going on, they will tell, I'm not taking my insulin. I'm not taking my metformin. I had for breakfast pizza, but they will not tell that to the doctor. But you know how I approach them. So tell me, what do you eat for breakfast? What do you eat for lunch? What do you eat for dinner? And then they will start telling me what's going on. And that's how I can communicate the doctor or the nurse that need my assistance in that moment. Okay, this is what's going on. They're not using their insulin. And then I start as a community health worker, my work there is to explain or make sure why it's important to use your insulin, why it's important to use your metformin, why it's important to add a little bit of, vegetables, or, stopping a little bit at Burger King and McDonald's every single day, and we start from there. And when I had the idea to do these classes in the community, is because what I like, you can go the other one, this is what I like. Do a healthy recipe with them at the moment so they can understand what good vitamins or what good nutrition has in every single vegetables, but making something that it tastes good, making something that is fun, but they can practice at home. That's how I start. That's how I see that they get motivated, and then they ask me for recipes, or they send me photos. There, I prepared this. My goal is just to motivate them in healthy, but I need to make that approach face to face, and that's what I've been doing for the past couple of years here as a community health worker. I like to promote what is whole food plant-based. I know that in this program there's different doctors that spoke about diabetes, they spoke about nutrition. But what I do these classes, when I do them, I honestly do it promoting what is whole food plant-based, because we're supposed to be eating a certain amount of fruits and vegetables. And I always ask them, tell me, how many fruit and vegetables do you eat in the last week? How many? 5? How many? A dozen, good. Oh, good. So when they start counting, sometimes they tell me I ate hot dogs, I ate pizza, and okay. So whole food plant-based, the fruits, the whole food, the vegetable. How many are you preparing at home? Not much. How many times you went out to eat, maybe fast food? 4 or 5 times a week. What about if we start with 3 and then reduce to 2? And maybe once in a while. But what about we do that? Are you drinking water? I don't drink water at all. What about if we start a cup a day, and maybe tomorrow 2, and the next day 3? I see more beneficial things going like that, that when they have information, and all professions are so important. And when they ask me to calories and everything, they will go to dietitian, nutritionist, and I can help them with their referral. But the majority of patients don't like to count calories. My experience, they don't like that. They don't like to count, right? They're used to go and read the nutrition facts in their labels. So what I've been doing is, okay, you don't want to count calories, you don't want your nutrition facts. That means that we need to start counting how many fruits and vegetables we're eating in a week, and we need to eat a little bit more. Maybe the next month we add more, and that's the simplest way, because changing your diet or the way that you eat, we need to understand that that's not an easy process, and everyone can do it, but differently. I also share with them a lot of healthy recipes. I love to cook. And I share recipes with them so they can do them at home as well. Those are whole food plant-based that I do at home. I have plenty of photos, but that's too much to show here. But I just love that connection where they just show and share with me what they're eating at home. That's something that I really like to do. So maybe there's a lot more. There's a lot of resources that I do with my patients. I also have good resources for American Diabetes Association that I think everyone will get access to have one today. I also like to promote, before going to patient story, what is an app that I'm gonna show you how you can use the app, and we can practice here too. We're gonna have information, and we're gonna have to, whoever wants to volunteer, participate, or you can show me like a healthy plate. Like the one over there, or the plate that we have here. So in this process, maybe sounds a lot that I'm talking a little bit, but when I'm working with my patient and still have that challenge with the patients, or when I'm in the process of, you get home and you say, I don't know what I'm doing this week, I'm not what I'm doing tomorrow. I just hope that I am really impacting the community. Maybe just something small, but I hope that I'm doing something good for my patients and my community. So, and at the end, that's what really matters to me. That you make maybe something little for you, maybe something big for them. For me, it's been important to make my patients have all the resources that they need, and access to food, and access to health. That's my goal during this process. And to finish, this is something that I like to tell my patients: we are what we eat. Good nutrition creates health in all areas of our existence. But when I work with patients, I always tell them, do not compare with others when need to make changes in our lifestyle. What matters is progress, not perfection. Sometimes my patients compare a lot with other patients, so I have to remind them this. And also, super important, the impact on our daily diet is very significant in the development of health conditions. Good nutrition is essential to maintain a healthy life. It is important to know that you should not follow a specific diet without first consulting with a health professional or nutrition expert. There's the power of the social media right now too. If they promote like a diet and a lot of people in the community just read and start doing it, I always tell them no. You need to contact your PCP, get lab work, and then they will start to make it a referral for dietitian, nutritionist, but you don't follow any diet without consulting a professional first. That's very important. And what I like to do also, because in my classes, they always tell me, I don't know, then when I go to the grocery stores, what the foods that I need to choose, I have no idea. And I say, this is a good app. Yuca. I don't know who have heard about Yuca. Who have Yuca? Because I promote that in the class. There's difference, but this Yuca app, and I'm gonna show you how to use it. It's so simple. You download in your phone, you scan this, and what you're gonna see, you can show the rest one. As soon as you scan it, that's how you're gonna see it. As soon as you scan it, and we can do it do it here in the front when we finish the presentation. The app will tell you if it's good or bad, but because it's with colors, it's just so easy to read. And this is something so important from the patients that really want to learn how to read the nutrition facts, because it's not as easy. Here it's not that easy to read as this, because everything is with colors. So if it's good, it will tell you green is good. If it's bad, it's going to tell you a red color, but it will tell you it's bad. Why is bad, and then you will read why is bad. If that's additive, too calories, too many sugar, too much sodium. But you know what I like about this app too? If something is bad, at the bottom, it will tell you a better recommendation of something similar of the same product. I have so many patients that use this app, and it's so helpful when they go to grocery shopping, because they will buy a lot of whole food plant-based, but sometimes they will buy something in cans. They will buy something like peanut butter. I have patients that love peanut butter, but I don't know which one to use. Maybe organic, less ingredients is better. But when they scan it, they can know the difference. So this is one of the resources that I use a lot with my patients. And I will show you how to use it with my phone. I'll show you how it looks. And thank you for your participation. Let's stay healthy together. Thank you so much for your patience.